Importantly, they compared the DSM-based definition of NPD with grandiose narcissistic traits and vulnerable narcissistic traits. The findings are clear. A diagnosis of NPD did not reliably predict suicidal ideation, suicide attempts, or self-injury. And this is an important finding because it reflects the well-known criterion problem in the DSM, where NPD is defined almost entirely by grandiosity. Research relying on the DSM's grandiosity-based criteria will fail to identify individuals with the highest risk. Dimensional measures that include vulnerability provide far more accurate prediction and a much clearer clinical picture. Welcome back, everybody. This is our fourth episode of our seminar series. I'm joined today by my two associates here, Dr. Deanna Young and Mr. Danté Spencer. Before we get started today, I want to give everybody just a brief content warning. Today's video will discuss some sensitive material, suicidal thoughts, self-harm, and related behaviors in the context of narcissistic personality functioning. And while the discussion is clinical and research focused, some viewers may find the material distressing or activating, so please take care of yourself. Pause if you need to, and seek support if you find the content difficult. Okay, so I'll begin as usual with a brief summary of the article we'll be discussing. It was published in the Journal of Psychiatric Research in April of 2024. It's called Can Clinical and Subclinical Forms of Narcissism Be Considered Risk Factors for Suicide-Related Outcomes? A Systemic Review. So today's discussion is based on a recent meta-analytic systematic review examining narcissism and suicide-related outcomes. The authors analyzed 47 studies across 51 samples, which means that some of those studies had more than one sample, including clinical, community, and military populations. They looked at the full range of outcomes, from suicidal ideation to suicide attempt to non-suicidal self-injury, something else which is related but different called deliberate self-harm, overall suicide risk. Importantly, they compared the DSM-based definition of NPD with grandiose narcissistic traits and vulnerable narcissistic traits. Okay, so those were the three main independent variables. The findings are clear. A diagnosis of NPD did not reliably predict suicidal ideation, suicide attempts, or self-injury. And this is an important finding because it reflects the well-known criterion problem in the DSM, where NPD is defined almost entirely by grandiosity, something that we discussed in our first episode of the seminar series. Their data also show that grandiose narcissism itself shows little or no association with suicide risk, and it occasionally appears modestly protective. When it did relate to suicidality, the effect was almost always explained by co-occurring depression, not the narcissistic functioning itself. Okay, so that's on the grandiose side. In contrast, vulnerable narcissism showed a strong and consistent relationship with suicide-related outcomes across nearly every study. Vulnerable traits predicted suicidal thinking, self-injury, and the number or seriousness of suicide attempts. The mechanisms were also consistent, involving shame, emotional dysregulation, rejection sensitivity, and depressive collapse. The implications here are significant. Research relying on the DSM's grandiosity-based criteria will fail to identify individuals with the highest risk because pathological narcissism is a two-pole system. Only one pole is represented in the diagnosis we find in the DSM. Dimensional measures that include vulnerability provide far more accurate prediction and a much clearer clinical picture. This meta-analysis underscores the need to distinguish grandiose from vulnerable narcissism in assessment and research, and it also highlights the limitations of the DSM model for understanding suicide risk in narcissistic personality functioning. Okay, so that's my synopsis, and let's see what we'll see. What do you guys think of this?
It's really interesting because so much what we've learned is the connection between, you know, NPD and suicidality, and I guess really zeroing in on, the functionality of the subtype, the vulnerable narcissism actually is the predictor. And so, um, I guess what stuck out to me was like knowing this and knowing the continuum, um, that grandiose actually has the opposite patterns of risk compared to the vulnerable. So that really stuck out. So it's almost like the grandiose, I think the article says, let me see if I find a quote where uh, the grandiose actually, where is it says, when in grandiose, the risk becomes high, deliberate, lethal. So it's almost like, how am I trying to say this? What am I trying to say? When in grandiose subtype, um, it actually works to actually buffer, um, and almost overcompensate and protect. Like it's a protective factor. That's what I found interesting. It was a protective factor, the grandiose, almost like preventing the individual from suicide ideation in some capacity.
Yeah, yeah. Unless it was accompanied by depression, which
Yes,
i-
which is
interesting.
in the in China study, right?
That's right. Yeah. Yeah, it was a study from China that uh but there was another one too in there, I think.
Is it a
It wasn't just
military?
it wasn't just one study. It's but the sort of take home for me at least, and we can talk about this if you guys have a different idea about it, was that yes, for the most part, a stronger kind of grandiose profile is protective, and that makes sense. I mean, it's grandiosity is sort of the opposite of all the things we would imagine that would activate, suicidal ideation or behavior, unless it's accompanied by a strong depressive component, in which case I think it's sort of like what can happen sometimes when people are really depressed, and then they start like medication. And for some patients, there's this danger zone where the medication is activating. It helps bring them out of the more kind of like vegetative or lethargic or amotivational symptoms, and into a space where it feels like they have more control, or it feels like they have more energy, but the depressive ideations are still there. And so now you've got somebody who still has, the depressive thoughts, but also the energy to act on them. And so that can be a danger zone for the treatment of major depressive disorder with antidepressant medication. I think something similar might be getting picked up here, when somebody who's grandiose sort of seeks to gain control over their depressive ideations by basically the term I used for it in a presentation I gave a number of years ago was scuttling the ship. Uh,
Scuttling the shit?
Scuttling the ship. Yeah.
Oh, the
So,
ship.
yeah, like if you're like it's like an old nautical term, right? If the ship it doesn't seem like it can stay afloat, then you scuttle it, you sink it on purpose.
Mhm.
And I think a version of that can happen in grandiose presentations of NPD, which is one of the reasons I think why NPD, though this study didn't find any significant differences between the diagnosis of NPD, which we'll talk about because this is an important piece. How NPD is defined makes all the difference, right, in terms of the outcome data. But even though this study didn't find um, significant differences, in terms of suicidality. There are a number of studies that consistently find that though people with NPD don't make more suicide attempts than other personality disorders, their attempts that they do make are more lethal.
Mm.
So I think what we're seeing here is a related piece.
I thought that part was like that was the part that spoke out to me the most. Like those within a grandiose presentation are more likely to kind of carry out. And I thought it was captured really profoundly in what they said. One of the patients said, let me see if I can get it. Oh, it says individuals high in grandiose narcissism have a sense of fearlessness, in fact, claim to be able to achieve death if they decide it. And I felt like that really captured the grandiosity. Like, well, if I decided I can do it, but like on the other end of that, there's such a sorrow, um, like such an unreachable sorrow underneath that claim.
Can you say a little bit more about that? Because I think you're hitting on something really important there. Just the idea of like unreachable sorrow. I mean, just as like a phrase, it's really impactful.
I feel like the article was kind of highlighting that like there's a big like with narcissism, especially grandiosity, there's a big detachment between the sorrow that someone experiences with narcissism. So it's like they can't really touch the sorrow, but the grandiosity is like protecting from the sorrow. But I guess I feel like I just lost my train of thought. But
Well, you know,
I hope you picked
it,
up what I meant.
it's interesting, Deanna, because it's almost like that grandiose narcissism. It's protective, uh, and then the article says until the defensive structure collapses, which is interesting. And
Mhm.
then the risk becomes high, deliberate, and lethal. And I wonder if that's what you're talking to, um, where they're
Yeah.
almost confident, overconfident, um, in their SI.
Yes. Thank you for capturing my thoughts so beautifully. That's kind of what I was getting at. Like that well of untapped sorrow or unknown sorrow, they like fall into it.
Yeah.
Um,
There's another term for that. And I'm drawing a little bit. I gave like a presentation at like a conference a number of years ago on suicide risk in NPD. And when I was doing my like research for that presentation, the phrase I came across is Richard Corey suicides. And it's based on this old poem about this man named Richard Corey, who was sort of a well-dressed gentleman, like impressed everyone when he walked down the street, seemed to everybody that he had the perfect life, and then he goes home and, shoots himself, essentially. And I think the suicidality that we find in more grandiose presenting um, individuals can be surprising, can be shocking, and quiet and sudden and lethal. Right? It's not a cry for help, in other words. It's not an attempt to recruit support. These aren't gestures for this segment of folks who meet these criteria. This is um, a last ditch effort to have total control over a process that feels, I think, unmanageable.
Yeah, and it's almost like asking for help or getting support in those states would almost be too shameful.
Yes, yes, absolutely. And the article, and this, I think this is related, the article does say that in a number of these studies, that shame is a mediating factor in terms of suicide risk. Um, so maybe it's the shame that keeps somebody from asking for help, let's say, or makes it seem like the only way to fix the problem is just to take themselves out of the equation. Um, or maybe it's the shame that feels so unbearable that that suicide starts to feel like an option. Um, but either way, I think shame is absolutely a core affect in all um, narcissistic presentations. Question is, how overt is the shame? How consciously felt is the shame? Um,
Mhm.
but but yeah.
What I'm really starting to understand is that how limiting the DSM is with the NPD diagnosis. Because if it only emphasizes the grandiose, like what this article is talking about, then it's going to leave out the sub phenotypes, like the vulnerable narcissist continuum state, and there's not going to be much of a connection. But if, say, for example, in like the DSM-6, if they're really onto this and they're able to really have these criteria for vulnerable states or vulnerable narcissism as well as grandiose, then I'm sure then the connection between NPD diagnosis and suicidality would increase, I
I
gather.
agree, and I think this is really getting at a much deeper issue in the field concerning NPD, right? There is a legitimate question of like, what is NPD? Like, what are we talking about, right? Um, I just had that sort of online debate slash dialogue with Dr. Peter Salerno, who is really forwarding this idea that NPD is a mostly heritable disorder. But when we look at the underlying constructs there, right, like how is NPD being defined? What we find is that it's being defined in terms of like traits, grandiosity, right? It's being sort of conceptualized along like the big five trait dimension, like high extroversion, low agreeableness, stuff like that. And the DSM really pivoted toward that way of conceptualizing NPD in the 1980s in an effort to make it more objective and more measurable and whatever else, right? But now we're kind of paying the price here decades later as there's this renewed interest in taking a look at this construct. I think what we find is that the more we like identify this, what is a complex personality constellation, the more we kind of collapse it down and make it synonymous with one or possibly two traits, the higher the heritability estimates go up, right? Of course, traits are, they set the conditions, right? They're not disorders. Traits aren't disorders. Traits aren't
Mhm.
dysfunction. They're traits. And certain traits, yeah, are probably highly heritable. Um, but when we pull back, as the field is increasingly doing in the last decade, and take a look at take a look at NPD as a disorder as opposed to a trait, now we find that the situation gets much more complicated, right? And this is how we've been talking about NPD as well, not as the trait of grandiosity or the trait of low empathy, but as a disordered self-esteem regulation system. And when we look at it through that lens, all of a sudden everything changes, right? We find that no, NPD isn't protective against suicide. It's highly correlated with it, right? Just not in certain self states. But the question still remains, are there people out there who kind of are just high in trait-based grandiosity and low empathy, right? Can we rightly say that they have NPD? Or are they just, is that something else entirely? Is that not even a disorder? Right? Maybe that's just unlikable, disagreeable traits, not a disorder. In which case, fine. And lo and behold, it's not correlated with suicide risk. As we would expect, we wouldn't expect things that aren't disorders to be highly correlated with any signs of psychological distress, right? Um, but when we look at the full picture, when we factor in self-esteem collapse and emotional dysregulation, right? Rejection sensitivity, contingent self-esteem, hiding the self, entitlement rage, all the things that are being slowly identity disturbance that are being slowly pulled back in under the kind of umbrella of narcissistic pathology. Yeah, now we start to see, yeah, so sometimes for some people the risk is really low, but for other people the risk is um, hugely amplified.
Yeah. It's interesting because, I think sometimes it's tough to get out of, at least my head, that there's a continuum,
Mhm.
right? There's not like a vulnerable narcissism diagnosis and a grandiose.
Right.
Um, so you can almost argue that if just based on the DSM criterion that a PNI, the pathological narcissism inventory, can almost be a better detector of suicidality than NPD diagnosis if you're just going by the DSM criteria.
I think that's a valid argument. At least that's what this article demonstrates. Yeah. That once again, the diagnostic criteria we find in the DSM is woefully inadequate at identifying the very aspects of a clinical population that we most want to be able to consistently identify.
Mhm. Mhm.
This makes me think about the other article we read about I forgot the word it was, poly something, how
Oh, pleomorphic.
pleomorphic, there we go.
Yeah, yeah, yeah.
Wonderful word.
Nice memory.
Um, the pleomorphism of narcissism, how the presentations are so nuanced and some often paradoxical or seemingly paradoxical, and um, just how variable it is as like a disorder, as a construct. And I feel like it in this conversation, it's like illuminating how limiting the DSM can be and like looking at the categorical traits and just the traits in general and the observable things versus kind of incorporating that, you know, the superimposition of like a vulnerable or of a grandiose self on an authentic self and just those finer points.
Yeah, like fine points and at the same time like seismic like differences, you know. I was looking at how the studies that were used in this meta-analytic review. So just so everybody is on the same page, a meta-analytic review is like where they they take a whole bunch of studies. They have inclusion and exclusion criteria for those studies. They take all the studies that meet the inclusion criteria, and then they look at those results, right? Um, and they sort of they do some statistics on those results at a high level and to determine, okay, well, these are the trends, right? Um, I was looking at how the individual studies that they used, like diagnosed NPD, for instance, and they all used like diagnostic interviews. So those are interviews that are based, and you guys probably know this, but the folks at home might not. These are interviews that are like they're like formal interviews that are derived from the DSM criteria, right? So like one question might be, do you ever feel like you're better than other people? Okay, trying to get at like arrogance, right? Stuff like that. So that way of diagnosing excludes vulnerable presentations just simply because they're not a part of the DSM criteria, so they're not a part of the diagnostic interview, right? Um, the other way that some studies diagnosed NPD is they just did like chart reviews, or they, like hospital, like folks who were in a hospital, what was their diagnosis, that kind of thing, right? Did they have any suicidal ideation? So all of those would be categorical assessments, right? Just do you meet 5 of the 9 criteria that the DSM lays out? If so, you have NPD. Right? They're not dimensional analyses. They're not, in other words, they're not taking a look at like a more full uh, di dimensionality, right? So not just the arrogance, but also, th the more vulnerable facets. And so essentially, the studies that look at DSM diagnosis are the same as studies that are looking at grandiosity. Like the psychometrics are the same. So whether they just and the studies that looked at grandiosity used the NPI, which is the Narcissistic Personality Inventory. That arguably doesn't even measure psychopathology. It looks for folks that are highly like high in dominance, high in self-confidence, but it doesn't have any measures of distress at all. No vulnerable facet to it at all. And it used the grandiosity scale of the PNI. So that's the pathological narcissism inventory, the one that Danté was talking about, that does have a vulnerable piece, but what they did was just look at the grandiose scale, right? So the studies that just looked at grandiosity as its own variable are essentially the same as the ones that looked at, does the person have NPD? Does that make sense, what I'm saying?
Mhm.
I'm trying to for folks at home, I'm just trying to highlight the fact that they weren't really asking different questions with respect to, does NPD correlate with suicide versus does grandiosity correlate with suicide? Because when you look at what NPD actually is, the way it was actually defined across studies, they're the same. So what this study is really saying is that grandiose factors are protective for the most part, unless they're accompanied by depression. Vulnerable factors are elevate the risk. That's really what we can derive from this study, in my opinion. I'm not the authority of all things, but in my opinion, that's what we can take from this study.
Mhm. Yeah. Something that came up with me, and this may be a stretch, but I just wanted to get
Mm.
your guys' thoughts. Um, the article talks about, like you just said, Mark, that grandiosity functions as a protective factor. And it says these individuals externalize blame, deny weakness. I'm curious, and if there's that connection with the vulnerable narcissistic states and the connection with suicidality. I'm wondering if in the phenotype of grandiose or grandiosity, if there potentially could be a higher HI risk, homicidal
Oh,
uh,
I wouldn't.
ideation.
Yeah, I didn't mean to thought.
Oh,
I
did you?
didn't mean to interrupt you, but yeah, just I I thought the same thing when I was looking at that data.
Yeah, like it's almost like it's externalizing, the blame and everything on somebody else. I want to kill you versus like more vulnerable states of shame. I want to kill myself. And I almost would wonder about, the people who do commit, homicide or um, people who commit horrific acts of
Mhm.
mass shootings,
Oh.
what their state was. Um,
Yeah, I mean, I think we're going to be trying to figure out the mass shooting, phenomenon for a long time to come. As far as homicidal ideation, which is different than actually killing people, by the way, just like suicidal ideation is different than actually completing suicide. Um, in just clinically, in my experience, when I've worked with folks who had diagnosable NPD, who were more grandiose presenting, I did notice that the like violent fantasies or fantasies of like retribution or revenge
Hmm.
were frequently used to like try to neutralize or compensate underlying shame and fragility,
Hmm. So
right?
almost like a smear campaign would almost be an example of that. Could that be?
Something like that. Yeah. Yeah. So but the ones that I'm talking about are like private, like daydreams, you know, like fantasies, right? Like, you know, this guy at work is always talking like he thinks he's better than me, right? Okay, so already you can see the underlying fragility, right? Somebody who's actually confident wouldn't care if somebody else thought they were better, right? Because somebody who's really confident is basing their self-esteem on their actual performance rather than what other people think, right? So that's contingent self-esteem. It's basing your self-esteem on what other people think, right? Um, so the fragility there is that the person feels that their self-image is threatened by how somebody else thinks of them. And then they try to compensate for that or defend against that by having violent fantasies about beating that person up or shutting them down in a humiliating way in the next meeting or whatever it is, right? Um, and so that would be the externalizing piece of it, like the problem's not in me that I feel fragile. Um, and like I'm only as good as the last person who I talked to thought I was, you know. Um, it's in the other person who thinks they're better than me, and I'm going to show them, that kind of externalizing function there, which is, I think, it tends to be more grandiose, but it does also show up in vulnerable presentations as well. Um, yeah.
What would it look like for like a vulnerable presentation? Because I feel like that was like the externalizing example. What
Yeah.
would be like an internalizing?
Yeah, so one of the scales on like the PNI, one of the vulnerable scales is called entitlement rage. And you would think, just based on like face validity, that like the entitlement rage would be a grandiose scale, right? Because of course entitlement's grandiose, right? But when entitlement collapses into rage, that is considered a vulnerable factor. So it's still externalizing though. Is that making sense? Like, go ahead, Dante.
Yeah, so I'm wondering, so in those states where one would think that that's this grandiose behavior is actually vulnerable.
Yeah, well, and I think it speaks to just how amorphous and overdetermined the person's presentation can be. Like I think the temptation is to think of these as two discrete categories. The person is grandiose or they are vulnerable. When in reality, it's like there are 1,000 moving parts, and 475 of them might be leaning more toward a vulnerable categorical differentiation, whereas, whatever the difference is might be leaning more toward grandiose. So it doesn't have to be all or nothing. In other words, there can be parts of the person that are in collapse, even while other parts are more grandiose presenting.
Mhm.
Is it is it true that like where there's grandiosity, there's vulnerability, and kind of the goal is to integrate both
Yeah, I
to
mean,
have a more realistic?
that's how I see it. Yeah. Yeah.
Mhm.
Typically, I mean, one way of thinking about it is that, overt grandiosity conceals covert vulnerability. Overt vulnerability conceals covert grandiosity. And this is where like the entitlement rage piece comes in, right? So overt vulnerability, somebody who's raging because they didn't get their expectations were defied by circumstances, right? It turns out that their expectations were entitled,
Mm.
right? So the rage is a vulnerable presentation of a covert, grandiose expectation,
Mm.
entitlement.
Mm.
So it the fact is like when you really start to take these apart, you know what I mean? And like really start to look at them, you see that these ideas are mutually co-constructing. Like grandiosity is meaningless without vulnerability.
Mm. It's like different sides of the same coin.
The different sides of the same coin, integral to each other, and constantly in dynamic flux,
Mm.
right? Which is why defining the disorder of narcissism as grandiosity doesn't make any damn sense.
Mm.
Yeah, there are grandiose people out there in the world for whatever reasons, but can we rightly say that they're disordered? I mean, I don't know. That's the question, right?
I know I'm thinking about that, and I'm
Yeah.
thinking about like, I mean, what, how then do you kind of like describe what do you define disordered as? Like, is it the presence of distress, of disturbance, and what does that mean? But then I'm also thinking about like the like normal function of grandiosity, um, and how, because I'm wondering like, well, what is grandiosity without vulnerability?
Yeah.
And it's, I mean, I don't know. I guess my understanding is that it's striving. Like it, I mean, we need to be grandiose to like pursue goals and dreams and ambitions.
Sure, ambition, right?
Yeah.
I mean, nobody becomes, the leader of a corporation without some ambitious striving, right? The mere act of assuming the mantle of a leadership position of any kind is like it's audacious, you know.
Mhm.
Why should I lead anybody, right? Um, that being said, there's nothing wrong with ambition, right? If it's tethered to an underlying stability, a realistic self-appraisal, and there's some flexibility there, you know. The person can weather disappointments without collapsing into suicidal despair, let's say. Um, I think to my mind, we start thinking disorder when we start to see dysregulation, imbalance, distress, um, something that is untethered from consensus reality, in some meaningful way. In other words, there's a distortion, right? Um, I think the pull for a lot of people is to define NPD in terms of its effect on other people,
Yeah.
right?
Mhm.
In terms of its behaviors, its behavioral profile, so to speak. But that's not how we define any disorder,
True.
you know? If we defined NPD that way, it would literally be the only one that I can think of, right?
It's so
We
interesting.
define disorder in terms of what's going on inside. It's a mental disorder. It's not a behavioral disorder. Although I think managed care increasingly wants us to define everything in terms of, that's psychological in terms of behavior. Um, it's easier to quantify that way.
Yeah, that's so interesting,
Entirely
Mark, that
helpful.
it's really I'm trying to think of any other disorder where it's about the behavior of other people or what that behavior does to other people, and this seems to be the only one that really focuses on the other and not the disordered
It's
person.
because they defined away the internal distress. They got nothing left but how it affects or seems to affect other people.
Oh. Because if the NP if the DSM defines it as just this grandiose behavior, then it's like, well, they seem fine, but their behavior is affecting all their interpersonal relationships, and those relationships and those people are suffering, not the person, in the grandiose, you
Right.
know.
And that's
So
valid. That's valid in a way, I think. I mean, okay, like that's an important piece of the puzzle, but it doesn't have to be just a behavioral disorder, you know? It can also be a, a mental disorder. You just have to like broaden the horizon a little bit, as is happening, to include the actual distress that has been excluded by definition. And that's what has driven all the stigma too, you know, because it's a discompassionate portrait. It's a portrait of an asshole. Um, and sometimes people with NPD are assholes for sure. Like, but people with all people are assholes sometimes, you know?
Yeah.
I don't know. We've wandered a little far afield though of the idea of suicide risk and self-harm, and I do feel like we maybe should spend just a little bit more time on that because it's what the article's about, but it's also um, it's counterintuitive. People don't. Whenever I tell people that this population is at risk for suicide and self-harm, they look at me like I'm speaking a different language
mm,
because
mm,
it runs so counter to what people expect, you know. And this is another piece here, and then I'll shut up about it. I'm increasingly convinced that it's not just the full syndrome folks, right? Like us, versus the grandiose trait folks, right? There is a third player on the board here, and it is the sociocultural construct of narcissism that is, at this point, a self-perpetuating, you know, institution, right? Nobody's in charge of it, but it's what you find if you type like NPD into any search bar, you know. The TikTok narcissism, the lurid, scandalizing, heavily stigmatized, you know, narc, right? That just is just abusive
mm,
and deliberately so. And I don't know what construct validity there is to that. I think it's the result of a lot of folks feeling hurt about their relationships or their parents and just kind of getting sucked into this dominant narrative that is increasingly everywhere. Somebody hurt you? Did they seem selfish? Did they seem insensitive? They were a narc.
mhm,
That was a narcissist, right? And so when people hear that narcissism is a risk factor for suicide, and they imagine the boogeyman version of narcissism, that doesn't make any sense at all to them. And I've even run into folks in the comment sections, who celebrate that. Good,
mm.
good riddance, in other words, which is just it's mind-boggling
Yeah.
to me. But
Yeah, so it's almost like can have a little more empathy for people with the disorder, knowing that they have such a high suicide risk comparatively. And I think it would help people look at the disorder differently. because they suffer, right? And we see that in our, in our patients, they're suffering, they need support. It's suffering where maybe others don't see that suffering that goes on.
Right. Or the person that they have in mind doesn't even have narcissistic pathology, which is another possibility, right? Um, or the asshole at the work party or whatever that they've got in mind. Like it's impossible to imagine that guy, struggles with suicidal thoughts. But again, what we're talking about is an actual mental disorder, not just a constellation of aggressively unlikable traits. Not even people who abuse other people. We're not talking about that either. Some folks who have these issues abuse other people, but it's not a part of the essential feature. It's not an essential feature of the disorder by any definition.
This stigma really worries me, especially around like engagement, because this is such a um, there's a huge barrier in engaging folks with pathological narcissism, especially folks that have like a grandiose,
Yeah.
kind of lean more grandiose. Um, but then I feel like all of this stigma is a barrier for people who might have narcissistic pathology to engage because they're afraid of, well, what if I find out that I'm this monster everyone's talking about, which limits them from really accessing the care they need to meet their distress.
And even if they do, like we do a number of assessments, right? So let's say somebody comes in to get assessed and their worst nightmare is that they qualify for an NPD diagnosis. And then we find that they do. Even using more alternative criteria based understanding that we use, right? It's more of an identity disturbance than like the asshole disorder, right? Or the abuser disorder. We give that feedback and it triggers shame and underlying emotional dysregulation. It activates um, collapsed, empty, um, you know, devalued self-images. It sends the person into a spiral, right, of feelings of worthlessness and and being fundamentally broken or invalid, right? In other words, we're at a point now, we're telling somebody that they have this disorder um, is is traumatizing in its own right because of how vandalized the the term has been.
Yeah.
It's like I mean, it really does concern me too. Even, like I've got folks, that I treat that I have also assessed that, we spent a lot of time talking about like j just trying to like do damage control around what this diagnosis actually means.
Mm.
Because I mean, this is the irony couldn't be any thicker, honestly. Like this is a disorder of where self-esteem is fragile and unstable. And in the popular mind, it couldn't be any more maligned if it was a conscious global campaign. You know what I mean?
Yeah.
Like, how do you tell somebody who has fragile and unstable self-esteem that they have a disorder that in everybody else's mind is the worst possible fucking thing you could possibly have.
Totally.
You know, like it's like the disconnect is just so wide that it's like we almost have to come up with a different term.
Hmm.
It's like this, do we have to throw this term away? Like it's just it's been rendered at best meaningless and at worst, and this is what I fear, and I think what you're talking about too, Deanna, like it does harm.
Mhm.
But it's also the correct term. And so I think a part of the work that we do here, to my mind, it's not just treating folks with these issues, but trying to like restore some sanity to the cultural discourse around what this is and what it actually looks like and what how the people with it actually suffer. Yeah, the people around them can suffer too, but that's also true of literally every other mental disorder.
Hmm. Such a
Uh,
good point.
I would get down off my soapbox now, but I get my feathers ruffled about this just because it feels
Yeah.
so like, what is happening?
Hmm.
Yeah, the way you depicted it about just someone who struggles with self-esteem and then the rest of the world hates that disorder. It's so painful.
Yeah, yeah.
So what do you think? What do you think, guys? So if we know that the DSM d doesn't take in consideration really of the vulnerable narcissism, and vulnerable narcissism is marked by shame, the hypersensitivity, the fragile self-esteem, and withdrawal, which we know is from this article is most consistent and robust predictor of suicidality across like all the reviews. Where do you see? Where would you like to honestly see the DSM going or the NPD diagnosis going, like as we move forward?
Deanna, I want to give you a chance before because I'm revved up, so I'll I'll give like a 5 minute diatribe, but I wanna,
Well, I think that DSM is like useful, but I really appreciate more like dimensional characteristics of the human experience and distress. But I guess I would love to see in some way the DSM capture vulnerable and grandiose presentations and just have a totally revamp like what it looks like. I did see the DSM has like some
the
other thing to
alternative.
consider. Yeah,
Alternative
Dr. Eames,
criteria.
maybe you can talk about that.
Yeah. That's I think if it goes in that direction, which I would be shocked if the DSM-6 or whatever the next edition, if it doesn't switch to a dimensional model across personality disorders, probably
Mm.
much more in line with the ICD. Um, and and narcissism be um, folded into that as disturbance in identity and self-esteem. That some of the time involves grandiose self-representations. Because it has, I mean, it has to, at least some of the time, involve grandiosity. But that is different than a trait-based grandiosity definition of narcissism. And like I said, the I think a lot of this, it's in vogue for some reason, this like, NPD is a genetic disorder. And it's because studies that uncritically use categorical diagnosis of NPD, which we know is just grandiosity, um, do suggest that there's a high heritable component to that trait. But when you use a dimensional model to diagnose, like a diagnostic interview that's dimensional as opposed to just the NPD criteria, those heritability estimates are cut in half. And I'm not kidding about this. They go from close to 80% down to around 40%. which is much more in line with the heritability estimates for all the other personality disorders. When we have a valid construct that's an actual disorder, we find that it's complicated and overdetermined, part heritable, part environment. When we collapse it down into just a handful of traits that are arguably not disordered at all, well, then we get these weird results, right? Like NPD is the least diagnosed personality disorder, right? Why could that be? Could it be that it's defined in a way that doesn't match the clinical reality of it? And so nobody wants to use it. Nobody believes they have any narcissists in their practice. And then when we use a dimensional model and look at the same data, boom, it goes up to the high estimate is 20% of outpatient psychotherapy patients have some component of pathological narcissism. I think it's much more pervasive than people think, but not in like the scary boogeyman skulking in the shadows, kind of way, but in a this is a form of human suffering, and we need to get our shit together and get good at recognizing this, or yeah, we're going to miss people who are legitimately at risk. And we're going to keep propagating this fiction that NPD is a disorder of emotional detachment when it's actually a disorder of emotional dysregulation.
Mm.
I also think about the future, and I'm wondering, just like knowing this and knowing a little bit more about the derivative and the continuum and the connection with suicidality and shame. I'm wondering if um, maybe some of the knowledge about this can help curb some of these environmental factors, maybe help parents,
Mm.
um, you know, because people, if it's environmental factors, right, that's their primary caregivers and experiential situations and traumas. So rather than just like that person just was born that way.
Yeah.
Well,
Yeah.
how did that develop, and how can we help people who are parents, are going to be parents, in the future, to really avoid, or just have more knowledge about like how that develops.
Yeah. Yeah. The issue of relational trauma, complex relational trauma, basically. When people think of trauma, like we discussed last time, maybe, or the time before, you know, people think of trauma as like, with a capital T. It's got to be life-threatening. It's got to be obvious. It's got to be something you remember, represent to yourself as trauma, you know? But I think we're finding that the kinds of trauma that disrupt identity like this, um, it's chronic. It's subtle. It's subtle emotional invalidation, you know?
Mm,
It's subtle shaming or
mm,
or rejection of the child's authentic
mm,
um, self and feelings. It's double bind situations that aren't obvious to the outside world, right? I was um I was at this thing and there was this kid who it was like a I don't want to be too specific. It was like a lessons, right? And there was this kid and he's trying his best. I don't know, he's 7, maybe 8 looking. And his parents are on the side and they just won't leave him alone. Like yelling out to him in front of the other kids, stop doing that. Do this instead. Do it this way. Constantly like just interjecting in a way that you could just see him, this poor kid, like just he's like boiling with like embarrassment and rage, and he can't express any of it because you can tell that this is the kind of interaction that happens all the time. And then like, another adult comes over who's like involved in the function, and they're like, why are you why the long face, like, come on, let's go, like how invalidating and what a double bind that is for the child. Can't be honest about how he's feeling because the parents will hear, but is made to feel like he's not doing it right because he's having feelings that are perfectly understandable in the moment, and is sort of being lightly mocked by the other adults. How, how do you synthesize all of that as a child, especially if that kind of thing is happening all the time? It's not visible to other people as abuse, so to speak.
Yeah.
But I'm scared for how that poor kid's identity and self-experience is going to turn out. And it's just I think it's just part of the cost, I think, of being like a mental health professional is like, you see these predicaments all the time that other people are oblivious to. Um, and it's always the question of, well, do I say something or not, or is this appropriate, or you know what I mean? Like it stuff like that is so subtle that you would be rightly told to mind your own business by a parent if you did, you know?
Mhm.
Like how do you explain to somebody that they're doing damage to their child when you can see it as plain as day, but the case to explain those dynamics would take an hour, like so I think you're right, Dante. I think this stuff is it's everywhere. It doesn't always result in narcissism. It can result in other identity disturbances as well, you know? Borderline personality disorder, that's one. So,
Good stuff.
yeah. Any final thoughts here before we wrap up?
I was just thinking about like the image or the scene that you described, and thinking about like also in the back of that kid's mind, and like probably a lot of kids, um like the presence of social media and what it presents as what's acceptable, or what one should be like, or um I feel like that's so prevalent in the like developing identities
Mhm.
now. And I just think about like what that must do to someone having this constant sense of being observed or evaluated, having to capture everything to engage socially, having this idea of like how one is supposed to be or act while being in this double bind, and how challenging that must be to like really connect with or understand your own self.
Yeah, I think that's a really valid point too. Um, when I was growing up, it was my only representations for how one was supposed to be were, at the movies or on TV, but it wasn't being piped into my brain 24/7 in this frenetic, ubiquitous way, like, social media. It wasn't being produced by everyone around me,
Mm.
you
Mhm.
know. Um, Everybody's like the star of their own show,
Yeah.
and it's all, yeah. I mean, these are like really it's like it reminds me of like gravity, like how gravity like warps like space-time, like a massive body like warps the space and time around it, it's like I
Mhm.
feel like there are these like um distorting, warping influences on our identities as grown-ups, but especially as on kids who are being raised with social media as like a major component of their experience. Yeah.
Mhm.
All right. Real quick, this is just kind of a PSA here for this article, just for clinicians who are working with this. I got to find my note on it here. Um, oh, clinical implications. Okay, yeah. It's important to differentiate grandiose and vulnerable narcissism. Do not rely solely on an NPD categorical diagnosis. It's important to assess shame levels and emotional regulation capacities, as well as interpersonal hypersensitivity, because those are the risk factors. Um, and include a structured risk assessment for suicidality. We have one in our practice. Every single patient who we treat or assess takes a brief suicidal risk assessment. It's really informative. Don't be afraid to ask those questions. And as far as interventions go, for vulnerable presenting patients, you want to target shame and affect regulation and self-esteem instability. And for grandiose presenting patients, you want to attend to depressive ideations. Narcissistic injury is the conduit into that. Interpersonal conflicts, where there will be a lot of externalizing, but to recognize that the underpinning of that externalizing is a shame-based fragility, and that is the risk. That's the mediating risk factor for suicide. Um, okay, well, more to talk about next time. Thanks, everybody.
Thank you.